My name is Carol Burns, and I'm your parish nurse, and I'm going to discuss the anxiety and stress you may be feeling. Pandemics can be stressful. The coronavirus disease of 2019 may be causing fear and anxiety about a new disease. What could happen can be overwhelming, causing strong emotions in adults and children. Public health actions such as wearing masks and social distancing can make you feel isolated and lonely, increasing your stress and anxiety. However, these actions are necessary to reduce the spread of COVID-19. Coping with stress in a healthy way may make you, the people around you, and your community stronger. Stress can cause the following. It can cause fear and worry about your health, the health of your friends and family, worry about your financial situation or your job, or losing the support services you can rely on. Stress can cause changes in sleep and eating patterns, difficulty in sleeping or concentrating, worsening of chronic health conditions, and worsening of mental health problems. It can cause increased use of tobacco, alcohol, and other substances. So, take care of your mental health. Fear and anxiety can be overwhelming. Get help immediately in a crisis. Call 911. Other resources that you can use are disaster helpline, National Suicide Prevention Hotline, the National Domestic Violence Hotline, the National Sexual Abuse Hotline, National Child Abuse Hotline, Elder Care Locator, and Veterans Crisis Line. Find a healthcare provider and the treatment for your mental health issues. Everyone reacts differently to stressful situations. How you respond depends on several factors: your background, your social structure from family and friends, your financial situation, your health and emotional background, and the community you live in. Changes can affect anyone. Those who respond more strongly to the stress of COVID include people who are at higher risk, the elderly, or people that have certain conditions, children and teens, people caring for family members and loved ones, frontline workers including healthcare providers and first responders, essential workers, those especially in the food industry, people with existing mental health conditions, and people who use substances or have a substance use disorder. People who have lost their jobs suffer from stress of COVID, or even if they have their hours cut. People with disabilities. People who are socially isolated, living alone, or those living in rural areas. People in some racial or ethnic minority groups. Stress can be stronger for people who don't have access to information in their primary language, homeless people, and finally, people who live in congregate group settings. Take care of yourself and your community. Taking care of friends and family can be a stress reliever, but it should be balanced with your own self-care. So, a few healthy ways to cope: know what to do if you get sick. Call the doctor before you start self-treatment. Know where to get treatment, including counseling and therapy. Take care of emotional health and think so that you can think clearly and react to urgent needs. Take breaks from watching, reading, or listening to the news, including social media. Hearing about the pandemic is upsetting and overwhelming. Take care of your body. Some of the helpful hints include deep breathing, stretching, or meditating. Eat healthy, well-balanced meals and exercise regularly. Get plenty of sleep and avoid excessive alcohol and drugs. And make time for things that you enjoy doing. Connect with others you trust. Share with them your feelings and your concerns, and connect with your community or your faith-based organizations. You can social distance, connect online, by phone, or mail. Know the facts to help reduce stress, to understand the risk you and the people around you face. Take care of your mental health, which is important to your overall well-being. It affects how we think, act, and feel. It can also affect how we handle our stress and relate to others. People with pre-existing conditions are particularly vulnerable in emergency situations. These conditions may include depression, anxiety, bipolar disorder, and schizophrenia. They influence your ability to function every day and relate to others. These conditions may be chronic or acute. Treatment of these conditions should be continued. And beware of any new or worsening symptoms. And be sure and call your doctor. And call your doctor if stress disrupts your daily routine for several days. People that are recovering from COVID-19 or ending their isolation can suffer from stress and anxiety. Each person may feel differently, but some of the emotional reactions may include relief, worry about your health and those of your loved ones, stress from having COVID and monitoring yourself, or those monitoring other people monitoring you, sadness, anger, frustration, because a friend or family member are afraid of getting the disease from you, even though you are cleared. Guilt about not being able to work during your isolation or not being able to parent while you had COVID. Worry about getting reinfected. Children may have strong emotions if they or someone they know has COVID, and they are now better and able to be around others. So in conclusion, some ideas about managing your stress include: focus on what you and your family do well. Positive relationships can help lessen the impact of stressful events. Practice appreciative communication. Each person deserves to be listened in your family. Take care of your health. That's the protective factor in stressful situations. Strengthen your spiritual resources. Let your values dictate your choices. Delay taking on any new commitments, and strengthen your money and time management skills. And last but not least, reach out to others for support. This concludes the Cozy Corner for this week. If you have any future topics for this program, give me a call so that I can address your concerns. Thank you.